So there are some key areas that AI and deep learning can help hospitals reduce cost. For this conversation, I'm going to focus more on the business side of healthcare. Of course, on the clinical side, there's just so many opportunities to look at readmission, social determinants, tracking a patient, throughout their care. For this discussion, we're really going to focus on the business side, and it's really around the operational data analysis. And more specifically is up to 40% of hospitals and healthcare providers are spending time chasing down information, this paper information, getting that data, and it's so time consuming. And so, it's really important that we unlock the data that's on paper. And how do we do that? And really, AI and deep learning is the tool to get us to unlocking that very valuable information and not having a file of paper. I mean, we're using technology, and then we're also using paper too, or we're scanning in paper, but we're not able to extract the details on the paper. So we really have to be thoughtful in how we use AI and deep learning. But there's really three components, and I'll speak to this more later on. There's process automation, there's cognitive insight, and cognitive engagement. And just real quickly on the process automation, that part of it is that we're really looking at pulling out the data on paper and putting a process together to analyze that. But there's so much exciting opportunities, and hospitals really should take a step back to see how they can bring in AI and deep learning. And certainly we've helped many hospitals start that journey or start that adventure. We'd welcome a conversation. If you've got any questions, we'd love to help.